Good morning everyone. I am Dr. AsmitaChatterjee, second year PGT from VIMS Kolkata. Here I am presenting before you all a case report which is an obstetric enigma rooted around a retained intrauterine device for 27 years, the forgotten fellow. As we all know, intrauterine contraception in a form of copper T is a widely used method with a little failure rate. Despite this, a term healthy pregnancy with a copper T in situ is a very rare event. Here is my case of a 53 years postmenopausal lady, para 3+0, who presented PMR OPD of our institute with a mild low back pain, for which a X-ray, lumbar spine and pelvis was done, and it showed an incidental discovery of intrauterine device in situ, and she was referred to our OPD. She has no other complaint. Her menstrual cycle was regular before she attained her menopause. He attained her menopause 9 years back. She had no other complaint of any postmenopausal bleeding or vaginal discharge. After a detailed history and several leading questions, it was revealed that the intrauterine device was inserted after her second childbirth. She conceived with the intrauterine device in situ 2 years after its insertion, but she presented late for her antenatal checkup as she didn't expect a pregnancy because presence of the intrauterine device, and she counseled to continue the pregnancy with the IUD in situ. Pregnancy was continued till term without any major complications, and she delivered a healthy child at a teaching institute in Kolkata. During her childbirth, the presence of intrauterine device in situ somehow overlooked and forgotten for the last 27 years as she was carrying itself within her without even knowing about it. On examination, everything was within normal limit. On perspective examination, no thread or part of intrauterine device was visible. All baseline laboratory investigation were normal. On imaging, transvaginal sonography, it showed that the intrauterine device inside the uterine cavity. A hysteroscopic examination of the uterine cavity and removal of the copper T was planned under sedation in OT. Here in the video, you can see that hysteroscopy was performed and copper T inside the uterine cavity without any distortion or embedment, or there is no distortion of the uterine cavity also. And you can see that in the video how was the copper T was removed. And here is the retrieved copper T without the thread, and probably it was a copper T 200B, which is no longer available in India. Now coming to the discussion part, from the previous studies and case reports, we know that pregnancy with intrauterine device in situ associated with so many negative outcomes. So ACOG always recommends to removal of the copper T if string is present as soon as the pregnancy is detected. And the most common cause of IUD failure is device luxation. On the other hand, retained intrauterine device for a long period may cause several complications like pelvic infection, uterine perforation or IUD migration. And there is also chance of spontaneous expulsion of the intrauterine device. Neither of these was seen in our case. In conclusion, I would like to say that our case was unique for its two major aspects. Firstly, a copper T being an unusual companion of a healthy pregnancy without creating any complications proves a medical paradox. And on the other hand, it also highlights that we should be more cautious after insertion of copper T or any intrauterine device. It is not only our duty to motivate the patient for contraception, it is also a duty to counsel them properly for timely follow-up and removal of it for avoid undue complications. These are my references. Thank you.
What is the instrument you have used during hysteroscopy to remove the copper T?
Hysteroscopy was done separately and to examine the location of the copper T and to examine the uterine cavity, and then arterial forceps was used to remove.
You cannot insert arterial forceps through hysteroscopy.
No, we have no device.
How did you do it? Did you do it yourself or did somebody else do it? If you do it, how do you do it?
I have to first, if the patient was postmenopausal, I have to do cervical dilatation. Yes.
Hysteroscopy is being done How would you remove the opacity in situ?
It can be in our case we use the artery forceps, and then to grasp the copper T, we have already seen the location of the copper T in the hysteroscope, and then it removed with the artery forceps.
Apart from
Apart from it, we can use also Sirotkar's hook, or uterine curette can be used.
But during hysteroscopy, it could have been done by any other instruments? Hysteroscopy?
Hysteroscope using
Hysteroscopic grasp.
Just diagnosed by hysteroscopically and removed by DNC.
Yes.
That you should have mentioned.
Thank you so much. Please select the certificate
From sir.
All of you, please give a huge round of applause. Please encourage the students. Thank you so much.